Good morning, everyone. Thank you for joining us today. I am so pleased to be here with Dr. Sylvanus Nawab as we both give an overview to you, the members of the public, and share the results of the recently completed third integrated care pathway entitled The First 1,000 Days. This is part of Bermuda's effort to implement universal health coverage. Recognizing this, the government prioritized this pathway in the 2022 throne speech, emphasizing its importance for the Ministry of Health. Ensuring access to fulsome quality care from day one is foundational for a child to have the best chance at a healthy living. Further, the 2023 Joint Strategic Needs Assessment, which was a study that set out to properly understand our population's health needs, recommended a public health needs assessment on child and maternal health, emphasizing the importance of focusing on the first 1,000 days integrated care pathway. The report that we are sharing today presents the findings of the study that was conducted to assess and map the island's current first 1,000 days integrated care pathway, and it incorporates maternal and child health and adjacent services. Led by Dr. Nawab, who is the Chief of Pediatrics at the Bermuda Hospitals Board and a pediatrician, with Edgewood Pediatrics. The multidisciplinary working group overseeing this pathway included the following: Dr. Ricky Brathwaite, who is the CEO of the Bermuda Health Council; Tiara Codlington, who is a policy analyst with the Bermuda Health Council; Dr. Atia Talbot, who is a pediatric officer at Bermuda Hospitals Board and the medical director of Ocean Rock Wellness. The objectives were to better understand current maternal and child health provisions in Bermuda, to assess the user experiences, and to identify existing challenges and opportunities. The work of this care pathway focused on 5 main lines of inquiry, including the following: service provider roles and responsibilities, service touch points, processes and handovers of care between service providers, patient and family experiences and what their care journey looks like, areas of overuse and or duplication or redundancy of services and inefficiencies in the provision, and existing and perceived challenges in the delivery and access of services. As always, stakeholder engagement was a critical component of this work. 40 interviews were conducted with patients and their family members, clinicians such as nurses, primary care providers, mental health care providers and specialists, and operational professionals, such as those providing service coordination, family services, and other relevant services. 3 interactive stakeholder workshops were facilitated to capture the views and feedback of care providers involved in the current first 1,000 days integrated care pathway, and the community survey received 375 responses, and the data of which was analyzed according to gaps, household income, and the type of insurance held. The results were used to draft a service map for maternal and health services. A service map is a graphic depiction of the various components and interactions of a healthcare service, highlighting processes, stakeholders, and touch points involved. It helps to identify areas of improvement and to optimize service delivery. Patient personas were also developed to understand patient experiences in the care pathway, and those experiences were plotted on the service map to create a journey map. The journey map breaks down patients' experiences across different stages of their care service, and it provides insights into patients' perspectives, needs, and pain points, enabling the healthcare providers to enhance patient satisfaction and outcomes. All of this work combined to highlight 8 key findings and 10 challenges being identified, along with 16 opportunities for improving the current state of the first 1,000 days integrated care pathway. Dr. Nawab will now take you through those key findings and their recommendations, after which I will discuss where we go from here, and outlined the work collaboratively made to strengthen the first 1,000 days integrated care pathway in Bermuda. Dr. Nawab?
So thank you, Mr. Wilson, and good morning. The first 5 years of a child's life is a time within which their brains are developing rapidly. The brain cells are connecting to enable movement, language, emotion, and other essential functions. Brain connections needed for higher level abilities such as self-regulation, problem solving, self-esteem, and communication are being made. And it's also a time where their daily experiences truly matter. As Minister Wilson indicated, proper health care from birth to their earliest years is crucial for a child's overall health and well-being. I'm pleased to share with you the findings that have come out of the first 1,000 days integrated care pathway initiative to date. In Bermuda, maternal and child health services are spread across several providers in both the private and the public sectors. Services which include but are not limited to antenatal, pregnancy, breastfeeding classes, doulas, OB, gynaes, postnatal care, maternal health, pediatric services, immunization, child development, and early intervention programs. Through the pathway mapping exercise, 10 challenges were identified and are included in the final report. First, the exchange of health-related information between healthcare providers, patients, and across various healthcare settings were found ineffective and creates challenges for those receiving care. Feedback from the patient interviews and community survey reflects a lack of consistency in the amount of antenatal care information provided to women across providers, which can impact patient experience. In particular, women who are under or uninsured may not be aware that antenatal care is available at no cost through public clinics, which has led to late presentation of pregnancy in the second and third trimesters. Access to maternal and child health services remains a challenge for many. Financial constraints and the limited availability of specialized care can impede individuals' ability to receive timely and equitable health care services. Options for affordable childcare are limited and affect women's economic opportunities. If a mother cannot afford childcare, she may be prevented from re-entering the workforce because she needs to stay home and care for the child. It can also impact the child's development, cognitive development. And for the mother who's out working 2 or 3 jobs to cover childcare and other necessary expenses, the child is missing time with the mother and the cognitive development that comes as a result of that time together. The current antenatal model of care is often perceived as outdated by both patients and providers. Care is fragmented across the island, mostly due to lack of communication between providers, both in the public and private sectors. Further, the lack of an electronic health record increases the challenge of coordinating care. The current care pathway lacks explicit considerations for mental health concerns, both during and post-pregnancy. The number of families needing access to early intervention services has risen in recent years, and long delays in accessing early intervention services are prevalent. This has been compounded by the effects of the COVID-19 pandemic and the limited number of human resources available. Chronic diseases such as chronic kidney disease and diabetes have a notable impact on maternal and child health within the current first 1,000 days pathways. While once regarded as products of adult behavior and lifestyle, these diseases are now being linked to processes and experiences during pregnancy or infancy. Lastly, patient empowerment through information and respect throughout the care journey is not a priority in our current state. Results from the community survey highlighted the difficulties women and their families face in accessing information that will support a better care experience. This includes care of premature babies, women's inability to access antenatal information and pregnancy records, and the lack of insurance coverage for antenatal, breastfeeding, and birthing classes. Knowing that challenges that exist creates an opportunity to identify areas for improvement. Our work to date has identified 16 opportunities for improving the delivery of care and overall health outcomes for our pregnant mothers and their babies. While detailed information on the individual recommendations can be found within the final report when it's available, the opportunities for improvement focus on the following areas: enhancing collaboration and reaching consensus on care, establishing community engagement and enhancing information sharing, formalizing the role of health visitors and fostering integration of mental health services, addressing barriers to care while strengthening communication with off-island providers, offering support to women from the start, and ensuring clear communication on what to expect, enhancing the midwifery role and focusing on the early years, establishing a link with oral health and organizing interdisciplinary care reviews, and enhancing support for families and empowering patients. The success of this work would not have been possible without the support and involvement of the working group members and many stakeholders who were willing to share their experiences. I would like to express my appreciation for everyone involved in the work, particularly those who lived with lived experiences. This is not work that can be done in isolation. A holistic and collaborative approach is required if you are to address the barriers to care that currently exist and optimize the health outcomes of our children both now and over the course of their lives. And they're most definitely worth it. Thank you.
Thank you, Dr. Nawab.
Yeah.
Over the past several months, you have increasingly heard me speak about the importance of the government's continued commitment towards implementation of universal health coverage and how collaboration amongst stakeholders is essential for successful implementation and priority of these recommendations. The first 1,000 Days organization tells us, and I quote, "The 1,000 days from pregnancy to age 2 offer a crucial window of opportunity to create brighter, healthier futures. How well or how poorly mothers and children are cared for during this time has a profound impact on a child's ability to grow, learn, and thrive." There should be no question then that ensuring that our families have equitable access to needed quality health care in the first 1,000 days of a child's life is a critical component in creating a foundation on which our youth can thrive as they become and move through their lives. And this needs to happen without creating a financial burden for families to receive the care. Together, we have the opportunity to enhance Bermuda's first 1,000 days of integrated care pathway, making it more accessible, affordable, navigatable, and ultimately improving health outcomes for our children. You've also said and heard me say that the ongoing work that is being undertaken to implement priority recommendations coming out of all of our integrated care pathway initiatives will only be successful with the collaboration and the work of all stakeholders. And this includes the government, health service providers, insurers, people with lived experiences, and our residents. So let me echo Dr. Nawab's expression of appreciation to the members of the first 1,000 Days Working Group and all the stakeholders who came together in this important work, especially the patients and the families with the lived experiences. Your time and effort will have a positive impact and will guide the next phase of work. A working group for the next phase of work will be formed, and their work will include prioritizing the recommendations that are contained with the recently completed report and then facilitating the implementation of the prioritized recommendations. To download the first 1,000 Days Journey Map, as well as the service map, go to www.healthstrategy.bm/latest updates. And in the words of Seth Berkley, who was an American medical epidemiologist, quote, "Healthy children are more likely to attend school and are better able to learn," end quote. So let's ensure that all of our children have the care that they need to thrive from the start. It is our privilege to make this happen. Thank you.
Thank you, Dr. Nawab. And now we've Roban.
Can I just clarify something, because I actually made an error, so forgive me. The important working group that was led by Dr. Nawab was, the participants were Dr. Ricky Brathwaite, who's the CEO of Bermuda Health Council, Tiara Carlington, who's the policy analyst of the Bermuda Health Council, and Dr. Atia Talbert, who is the
Pediatric officer.
Pediatric officer for the Department of Health. So I do apologize, so if you could please make note of that correction. Thank you. Sorry, Sarah.
No problem. Good morning. You'd mentioned universal health coverage, which has been mentioned for a while, and I know there's been challenges with how this is going to be funded. Is there anything more you could share with us on that, please?
No, Sarah, at this point, as we've indicated with respect to the timelines, and we have been speaking about it for quite some time because we recognize the importance of it, and the government remains committed to the implementation. We anticipate in the not too distant future being able to outline what the core benefits package will look like. And then from that, we will continue with the modeling and the financial analysis of how much it will cost and what it will cost to each individual. But there's still work to be done with regard to that. And as we progress towards that particular goalpost, I will be able to provide you more details as we progress. But we are working feverishly to be able to address the modeling and the financial aspects of the core benefits package.
Okay, thank you. Is there funding aside from that element of how this would be funded that the government has dedicated to this 1,000 days in terms of policy? You know, what kind of funding can we expect?
Okay, so like I said, the funding aspect and the modeling is being done. So we'll continue with that aspect. But we need to model what the core benefit would look like. And that working group is now in their final stages of being able to articulate, having worked feverishly for several months as to what will the core benefits package look like. Once we know what's included in the core benefits package, then we will then conduct the modeling for it so that we know how we will pay for that core benefits package. So all that work is done, is ongoing as I speak.
But just outside of universal health coverage, funding within, you know, the Ministry of Health for programs that are related to this, not to do with the health insurance, but government programs.
Sure.
Is kind of what I'm getting towards.
Certainly. You may recall that in 2021, and then we amended in 22, we amended the Health Insurance Act to provide for all women that were either underinsured or uninsured to be able to have maternal health benefits, which will include maternal health education. So we've allowed for those individuals that may be vulnerable so that the mother as well as the child can have the best start at life through insurance and through the provision of educational facilities and the like for underinsured and uninsured individuals. And that was when we made the amendments to the Health Insurance Act in 21.
Mm-hmm. Is there anything else you want to draw attention to in terms of work that's being done in this area by the government outside of the...
You would have heard one of the recommendations that came from this particular study spoke to the challenges that certain people encounter as it relates to paying for childcare. And we recognize that could be an enormous expense for a household. So we have made recent amendments, I believe it was 18 months ago, to add other individuals, to change the threshold for those individuals that could apply for the child daycare allowance so that we can encompass more individuals that were requiring that, so that we can ensure that parents are able to provide proper proper child care for their families. And if they need assistance, they can do so through the child care allowance.
Similar announcements in the budget with the out-of-school program and that sort of thing, where extra resources have been dedicated to that, to help parents, to help families with their childcare.
That's correct. That's absolutely that's what I'm speaking to.
Another
the child care allowance, and that's another example. Absolutely, yes. So the government is committed to ensuring that we provide necessary resources to families to ensure that their children are best looked after from a health perspective from the beginning of time, insofar as inception for the first 1,000 days pathway, as well as child care, after school care, and the like.
Mm. And is there a timeline or goal, at least, that's outlined in the report, or that the government has to implement everything that needs to be done?
I'll pass it on to Dr. Nawal, but as we've indicated, there are a number of recommendations, a number of touch points and key areas that need to be looked at, and the next step will be to form a working group so that they can look at these recommendations and start the implementation process.
To speak to that, I think, the first 1,000 days is just a beginning. It's not in isolation because work was being done before, looking at, as Minister Wilson said, the maternal benefits. We transitioned the maternal benefits into the first 1,000 days, and this will continue going in because we think that the natural progression is to encompass the first 5 years of the child's life. we have to take a step from one point going forward. And it's not a step in just, stepping and just stopping. It's stepping and keeping on going. And as Minister Wilson said, we've drawn the care map. We're now doing the financial models, and we're looking at how the first 1,000 days, the cost analysis of everything. There is a cost related to health care, and that cost changes, because things change, cost of living changes. So we have to factor on all those economic models and look at it and then plan it accordingly and take a step going forward with it. The intentions are good, and when the intentions are good, then the pathway is clear. And I think, as the minister is saying, there is a vision, there is progress being made, and it takes time to get things together. And we are working on it. As I know there's when things start, people get anxious trying to see the end of it. But it's actually, this is a work in progress, and we have to have that vision that it's perfection. It's never achieved in a way. You work towards perfection, but we're working towards making something happen. We have the good intentions to make sure that our children have a future. We don't want to see we want to see a change. We want to see a tangible progress. We want to see changes in people's health and life, making changes that will bring tangible results in the quality of life of our young adults. And this starts from this first 1,000 days.
Okay, just last question. And in terms of those changes, is there a process in place to measure performance of the outcomes you just spoke about, the changes?
Everything is being put in place to make sure that it's a success. And there's no success without evaluation. You cannot just establish something without having benchmarks to analyze how things are going to go. We cannot just run things. Nothing is being done blinded. And we've had, support from key stakeholders and from the ministry, support from the government to make sure that that pathway is being followed. When we start implementing, yes, there's processes that we need to follow. We need to move accordingly. There are guidelines that we have to make sure that are followed and evaluated. And the process will change. We might add, there's a whole component to things. There are things that will branch out and things that will be added later on. We just have the spine. There are a lot of things that go out, especially when it comes to early years intervention and early years education. There are many things that will give structure to the program. So the outline is there, and we are moving forward the outline, but we're also trying to build everything around it. The financial models, the payment models, the structure, so that this doesn't just become something that is just, a 4-year or 5-year program. We want it to be part of the structure of the health system.
Thank you, Minister Wilson. Thank you, Dr. Nawab, and thank you, Roxette. I think that concludes our press conference.
Thank you.